one of the doctors to spend a little bit of time with me this morning. Dr. Chichakli is joining me now. Good morning and welcome to the broadcast, sir.
Good morning, Ray. Thank you for having me.
Not a problem. Come right up to the microphone, and because it makes it sound better for the listeners to be able to.
Sorry.
We want to be able to hear the hair in your nose whistling is the thing. Now there are a couple of different disciplines that I get to talk about here. One of them is urology, which is it obviously has to do with the workings of that part of the body and all of the things that can happen. I'm thinking guy diseases, prostate cancers, and things like that you spend some time with. Yes.
That's definitely true. Guys are probably 75% of my practice, but we do see women. Women have bladder issues too.
Yeah.
Kidney issues, particularly after childbirth and whatnot. So, we don't want to exclude the females, but it is largely in majority a male discipline.
So dealing with stones and helping people to pass stones and pull those things out. What's the state of the art in dealing with, say, kidney stones or bladder stones?
Well, stones are, what I've noticed having been here, it's a huge issue on Guam. The incidence is almost twice what it is on the mainland, and it probably has to do with a lot of factors: genetic, climate, diet, dehydration. Mm-hmm. But it's definitely been a big part of my practice so far. Some things we've introduced here at GRMC is we call it the Holmium Laser, which is it's essentially a technology we use to blast stones, to break them from big stones into smaller stones.
Didn't they used to use sound for that?
We do still use that.
Still use sound
to some degree, but this is sort of the next step, the next generation from there. It's a direct look with a very tiny fiber optic scope at the stone, and then you use a little bitty laser to essentially break it into little pieces.
Huh. That's how long has that been out?
Well, it's been on Guam for just about 8 months. But on the mainland, it was introduced in the late 90s.
Yeah.
The problem is it is expensive tech. The machine itself costs quite a bit. The scopes are expensive, and they cost a bit to maintain. So that's probably why it hasn't been big here on the island yet. But now with the new hospital, we have it going, and it's definitely better and easier for the patients.
Well, I was going to say, describe that process for me. I mean, you go in with a small hole someplace, and then you maneuver your way up to where that stone is going to end up being?
Right. Well, in the old days, it was a big hole, so we made a large incision to go in and get the stone out. Nowadays, it's no holes at all. We actually use the natural openings.
Yeah.
So we go through the urethra, the urinary channel, and we can go all the way up into the kidney with the small fiber optic scopes. So it's basically an hour procedure. It's outpatient.
Outpatient.
No incisions at all. It's some urinary discomfort, as you can probably imagine, from having a scope in there, but folks are asleep when they have it done. So overall, very, very tolerable and much, much better than the old days.
I was going to say, I remember the old days. That was, a couple of days in the hospital in front of it, then you have the surgery, and it's a couple of days worth of recovery on the back end of it. But, if you did it right, you always came out with a little stone you could turn into jewelry or something. Some kind of keepsake if you really wanted to. I tell you what, I love the conversation about the new technology that GRMC is bringing here. And again, you've already been seeing patients. You've been here for a year, and you've already got a stable of patients that you'll be able to take upstairs with you before too much longer. But I also, it's the technology part that I get excited about when I think about this hospital, because there's so much of it. Now, you've also got a lot of experience in robotics. And robotic surgery and that kind of thing. How much of that are you going to be able to do when they open up the suites for you?
Well, that's a good question. And currently, right now, none.
Yeah.
Robotics it's even newer. It's only probably been around for about 10 years, but it's really taken off on the mainland. The problem is the robot, the machine that we use to do the surgery, is very expensive. In excess of $2 million. Plus the necessary parts to maintain it and be able to use it are quite expensive. So even in the States, on the mainland, it's really only in the big centers right now.
Okay.
Now I'm hopeful, and I'm constantly gently nudging management to consider it. And I really think it's the wave of the future, and it will only become more popular and more widely used.
Well, they've had it around for a while, and let's call it 5 or 10 years in the medical industry, and that's in terms of the rate of technology, that's ancient history now. When they first came out with these things, the newer ones, are they not scalable? Don't they? Do they have any now? Like I don't want to say a beginner's kit, but it's like here's the small version, and then if you want to add capability as time goes by, then here's another arm, here's another processor, whatever.
Well, you're absolutely right. They're on the third-generation robot now. It's essentially just one company that's dominating the market for that, called Intuitive. But they're on their third generation. But unfortunately, as the new generations come out, the older ones become obsolete. So it's not really an add-on grow from where you were. So it's essentially, if hospitals want to upgrade, they have to purchase the newest, latest, greatest model. Most, and the one I practiced on in San Diego was the second generation. The third generation just came out this year. But it's amazing how quickly the technology moves. And each generation, the machine is considerably smaller, better maneuverability, better capability. So it's moving at light speeds.
The question that I want to ask, only because I'm immersed in Hollywood and probably watched too many movies, is what about artificial intelligence? Are they building any kind of AI capabilities into the robotics?
Well, you and the FDA are worried about that. Because
well, I wasn't worried. I'm just curious.
Well, actually, prior to the robot being approved, the company had to add a kill switch to it. So, there's no way the robot can take over and run amok. It's basically a tool for the surgeon, and it doesn't do anything that the surgeon doesn't instruct it to do. So if I move my right hand, it moves its right hand, and there is no AI to it. But because of concerns like that from the public, the FDA actually mandated that we put a kill switch on it. So there's a giant red switch that you can hit at any time that will turn it off.
Now, you don't necessarily need to be in the room to work these machines, do you?
You don't, and that is actually initially developed by the military. They were going to have sort of battlefield robots that would operate in the field, and the surgeon would be protected back on base. It didn't really take off for that use, and you're absolutely right. You can do that. You can have remote telesurgery. Most places, though, the console or the place where I sit to control the machine is in the room, which is probably even the optimal situation, because then you can get up from the console, check the patient if you need to, make adjustments to the arm if necessary.
But how does it compare with actually doing surgery on a patient? I mean, with your hands and the gloves.
Well, the way things have progressed, they've gone from open surgery to laparoscopic surgery, which is small hole surgery, which we can absolutely do here, and we'll offer the full complement of it here. The problem with laparoscopic surgery is the instruments are straight. They don't have any maneuverability. The advent of the robot, they're really like little hands that you can use. They have wrists, so you can turn and sew. And
articulation, I think.
Absolutely. The articulation is incredible. It's really impressive engineering.
Well, it's too bad we don't have one here yet.
Yes, that's right. The optimal word.
I know some of the people in the management that you've got to talk to, and I'll say, gee, it would be great. It's too bad we get the grand opening, but there's no robotic surgeon around here. What the heck? What's going on?
Please do.
I might mention that. Now, you're not the only MD in the house, are you?
No, there's
your wife.
My wife should be mentioned first. She's a cardiologist. So she's also very excited to be here and about the technology that they have in her field as well.
Yeah, well, I know that there's a big call for that, and at some point I might get around to having a conversation with Dr. Mike Cruz, and he's has been an advocate for many years for increasing, obviously, access to healthcare, but in particular doing things specifically for people that have got some cardio issues. And,
absolutely.
It's for all of the same reasons that you are busy. There's a lot of business in the cardio field.
Absolutely. No, that's very true, and she's noticed that certainly in the years she's been here. There's certainly a very large need, and her specialty is actually unique to the island. She does arrhythmias and people that need pacemakers, and so she corrects those with various procedures, implants, ablations, and whatnot. So stuff that folks...
So she does that here?
She does that here, absolutely. And that's stuff that folks used to have to go off island for.
I was going to say, I know somebody that had to go just a year ago out to Los Angeles for that kind of work.
Right. Well, that will be something that she'll be bringing to the island here, so people will be able to stay locally for those services.
Well, that's the idea. That is the idea. You build something like this, and that's fewer patients that will have to get on the airplane and go be met with a wheelchair at the airport in the Philippines or Hawaii or California. We'd like to have those patients stay here because it means their families.
Absolutely. More social support, people tend to do better.
You got any kids?
We have 2 boys, 7 and 5.
Oh, boy. That's a good set of ages for boys.
They're a handful. They're enjoying themselves. They really like Guam.
They keep them busy on the soccer fields?
Playing soccer, playing basketball, going to the beach.
Yeah.
It's a good place for young guys.
Not a bad place to raise a family for sure, and not a bad place for a medical practice. It's a pleasure meeting you.
My pleasure.
And maybe next time I get around to doing that big physical thing that will involve a certain procedure that all men are shy about talking about, I'll come and see you.
I will be here.
Okay. See, I don't know if I like the idea. I'm not crazy about, because I might see him again later on after that particular procedure. I don't know. It's just like a second date, if you will.